Ketamine therapies have been found to be effective in post-traumatic stress disorder. More recently, there have been studies demonstrating that a series of 6 ketamine infusions can be highly effective in the treatment of post-traumatic stress disorder to augment underlying psychotherapies and medication support. I'm Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia, and we're going to discuss ketamine therapies for post-traumatic stress disorder. Now, what is PTSD? Well, it's the presence of recurrent, intrusive, distressing memories, dreams, and dissociative reactions such as flashbacks and reactions to internal or external situations that resemble the traumatic event experienced by that individual. And examples would include specific traumas like sexual assault and serious injuries, or witnessing or experiencing severe trauma of a friend or a family member. And key symptoms associated with PTSD include intrusive thoughts and recurrent memories of that situation, or dissociative reactions, and even hyperarousal. Now, PTSD affects quality of life significantly in individuals, and those with PTSD are twice as likely to attempt suicide than the general population. About 13 million Americans have PTSD in any given year, and this translates to about 5% of the adult population, and it does impact the individual's ability to function normally. The average person with PTSD loses about 3.5 days of work per month due to triggered symptoms. Now, most cases of PTSD usually begin within 3 months of the event, but it can also begin many years later. Other aspects of quality of life that are affected include the psychiatric comorbidities that occur with PTSD, such as major depressive disorder or anxiety, and this can reduce your health-related quality of life. Also, it can increase morbidity and mortality. There is an impact on lifestyle, with 40% of patients with PTSD describing their symptoms as having a negative effect on their social or occupational functioning, even 10 years after the onset of the disorder. Other individuals will complain of sleep disturbances, social isolation, and even brain fog or cognitive dysfunction. There are a number of categories of symptoms that people experience with PTSD, which include reliving the trauma again and again in their thoughts and memories, and this includes flashbacks, hallucinations, and even nightmares. Individuals will have increased arousal, and they'll have excessive emotions or emotional states to events around them. They'll have difficulty falling asleep, irritability, outbursts of anger. They'll just feel jumpy or easily startled. There can also be negative cognitive abilities and mood statuses, meaning that they just feel depressed, or they just have issues with self-blame or estrangement, just negative feelings in general. And of course, avoidance. Individuals will avoid people, places, and thoughts or situations that can remind them of the trauma. And this can prevent an individual from losing interest in their general activities or in enjoying generally being out in the open with other people. Now, we know there's poor treatment outcomes with traditional treatments in general. Now, psychotherapy has the most support in terms of its outcomes. Cognitive behavioral therapy, cognitive processing therapy, and prolonged exposure therapies have a lot of support for efficacy, but they can take time to work. And medication support has poor outcomes. Only about 20 to 30% get remission with the 2 FDA-approved drugs for PTSD, which are paroxetine and sertraline. And there's a significant rate of non-response and dropouts in these individuals. And likewise, there could be side effects such as weight gain and hair loss, sexual side effects, and anhedonia, which is emotional blunting or numbness. And individuals may find it takes months for these medications to actually work. So, does ketamine therapy actually work for PTSD? Yes, ketamine has been found to be effective for chronic PTSD as a series of 6 ketamine infusions over 2 weeks, with resulting reduction in depressive symptoms, intrusive thoughts, hyperarousal, and even avoidance symptoms improving. There's also improved mood and cognitive abilities as well. So the neurobiology of PTSD and why we would use ketamine are kind of tied together. Glutamate has been found to be a primary excitatory neurotransmitter in the central nervous system. It modulates stress responses and memory formation, including trauma memories. So the symptoms of PTSD may be caused by a loss of synaptic connectivity and low neuroplasticity due to abnormalities in glutamatergic functioning. Now, stress can impair synaptic connectivity, and it can result in dendritic atrophy seen in animal models of stress. Dendrites are where connections occur between neurons in the brain. It's been found that repeated stress results in neural atrophy and synapse loss in the key areas of the brain involved with mood and memory and decision making, the medial prefrontal cortex and hippocampus in particular. It can result in smaller brain volumes in these areas, and this has been seen on MRIs and MRI studies. Exposure to chronic stress results in atrophy in these limbic brain areas, and these areas are associated with mood and fear learning. So it's been found that excessive NMDA receptor activation, which is a specific receptor involved with glutamate functioning, it is increased in individuals with PTSD and can result in difficulties with intrusive memories and memory processing. And so high NMDA receptor activity can be a risk factor for developing PTSD. Likewise, NMDA receptor antagonists may help to enhance fear extinction in individuals with PTSD. And ketamine, by the way, happens to be an NMDA receptor antagonist. Ketamine works as an antagonist to an NMDA receptor and ultimately promotes brain-derived neurotrophic factor formation, which is like fertilizer for the brain, and increases something called mTOR, which allows protein production that causes the production of proteins involved with synapse formation and dendrite formation. And it's been found that ketamine in subanesthetic doses promotes neurogenesis, or the formation of new neurons, as well as cell proliferation and synapse formation, or synaptogenesis. Now, post-traumatic stress disorder symptoms are multifaceted and are associated with overgeneralization of fear responses and deficits in the memory reconsolidation process, in which the original trauma is forever stored in that original form and is resistant to spontaneous modifications after trauma recall. So, in other words, individuals with PTSD have basically impaired trauma extinction ability. They just can't forget what they saw. And they also have difficulty with learning in general. And this results in heightened amygdala and sympathetic activity, or in other words, increased anxiety. Now, what ketamine therapy does is it improves this glutamate system balance and improves overall function. So I kind of take a look at what happens in the brain and stress as an example of trees and their leaves falling off in the fall. And the tree on the left being one that is a normal tree of neurons in the brain, and these being dendrites. And with stress, these dendritic spines kind of fall off just due to the stress itself. And it's been shown that stress in the form of traumas, for example, or other types of external stresses, that we see, such as medical complications and drugs, alcohol, smoking, and medical complications can result in a loss of connectivity within the brain itself. So in a normal mood state, we have normal connectivity, whereas in depressed or traumatized individuals, you get fewer neural connections and lower synaptic plasticity. In other words, things get over-pruned, such that instead of having lots of dendritic spines where new connections can form, like over on this left side, we have fewer dendritic spines as seen in depression or even PTSD. And so we know that brain cell activity and connectivity is impacted with stress and trauma, and that basically we see volume loss in depression. And this can result in increased brain aging, metabolic risk, and cognitive loss. So we see basically brain volume loss with depression and stress. And this affects the ability of your brain, which is the computer, to work effectively. So the use of ketamine might enhance the ability for memory reconsolidation. It may allow us to help alleviate post-traumatic stress disorder symptoms. There have been 2 trials that were of note more recently that demonstrated efficacy of repeated ketamine administration in chronic post-traumatic stress disorder. And one more recently was in 2021 with Adriana Fetter and her group, demonstrating efficacy with repeated ketamine infusions for a series of 6. So we found that ketamine therapy works rapidly in patients with depression and PTSD. In fact, there were improvements in 3 of the 4 PTSD symptom clusters, which include improved sense of negativity, and individuals had improvement in their cognitive abilities and their mood, as well as decreased intrusions and decreased avoidance activity as a result of ketamine infusions. And also, it was noted that in the ketamine infusion responders, there was improvement in PTSD symptoms rapidly, even within the first 24 hours after the first infusion. And this was maintained for a median of up to a month after the initial series of 6 infusions. Likewise, there was also noted to be a comorbid reduction in depressive symptoms in the ketamine group as well in PTSD symptom patients. There were also other trials demonstrating that there was efficacy, safety, and durability of repeated ketamine infusions for post-traumatic stress disorder and treatment-resistant depression in a study by Albert and his group, which demonstrated an 80% remission rate in PTSD and response rate in treatment-resistant depression of 93%. And that also, these results lasted for up to 40 days. So the ketamine infusion process is generally an initial series of 6 ketamine infusions over 2 to 3 weeks. Each infusion is approximately 0.5 milligrams per kilogram, administered over 40 minutes, twice or 3 times per week, usually like on a Monday, Wednesday, or Friday, not back to back. And each infusion is basically 1 hour long, approximately, because it takes a little bit of time to kind of gain your bearings and get up out of the chair. So you got about 40 minutes of the actual infusion and about 20 minutes to kind of recover afterwards. Booster infusions are needed, though, from time to time, as individuals may have some recurrence of symptoms at a later time. And so booster infusions are commonly done every 4 to 6 weeks in individuals who need that type of support. You also need to have continued medical support and psychiatric medication support as well. So it's important to continue your underlying medications unless there's significant side effects from them, in which case either they can be altered or you can consider other treatment options. Now, we often and frequently will include home-based racemic intranasal ketamine and oral ketamine therapy support for maintenance as well. And finally, don't forget continued psychotherapy or ketamine-assisted psychotherapy support, as well as lifestyle interventions such as exercise, eating well, socialization, and structured time, and of course dealing with addictions such as alcohol or other substance use disorders.